All right. Well, welcome everyone. I'm Natasha Bonham, Director of Baby's First Test, and I'm so happy to be able to invite you all to this session today, looking at newborn screening is innovation and how different groups are engaging families in the newborn screening system. Next slide. So, what are we doing here today, right? Today, we really are bringing together innovators and different stakeholders to share strategies on how they authentically engage families in the newborn screening system. With an evolving newborn screening system, we are always thinking about, how do we engage families so that this changing system meets their needs and reflects their experiences. There's so much that goes on in newborn screening, and there's so many different components, and it's an amazing system. And at the same time, we always want to come back to the fact that at the center of the newborn screening system are our families, are those babies and their families. And for us, that really is having a focus on connecting with each other, strengthening the systems that we're in, and innovating. Really building upon the great work that has been done in the past so that we can continue to meet those needs of families. Next slide. We are thrilled to be able to highlight the winners of our inaugural GRACE Awards, GRACE standing for Generating Real Action by Cultivating Engagement. This summer, we kind of got together and thought, it'd be really great to be able to highlight some of the amazing work that's being done in newborn screening with a particular focus on how families are engaged, how families are truly made to be partners in this work. The focus of the GRACE Awards was really a team approach. We were really focused on knowing that no one person makes any one part of newborn screening happen. It is always a team, and typically a diverse team with people of different backgrounds and different skill sets coming together. There has to be a bit of innovation, and I think sometimes people think innovation has to be some splashy new technology or something completely out there, but sometimes innovation is just trying a bunch of different things and seeing what sticks and being innovative enough to know sometimes one size doesn't fit all, and how do you really meet families where they are. And then of course that engagement piece, and engagement can look a lot of different ways, and I'm excited to be able to later on have our presenters talk about the ways that they have engaged families. Next slide. And so a round of applause for our first GRACE winners, which are the Connecticut Newborn Diagnosis and Treatment Network and ScreenPlus. We had a number of amazing submissions, and it was really exciting to be able to read all this great work that is happening across the country, and to have these two programs really kind of, as they say, take the cake and be able to highlight kind of just different ways of engaging families, really thinking about that long term, and now to be able to share that with you all. Next slide, please. So I'm going to do the introductions for our speakers today now, so that they can kind of flow into their presentations. And first, I want to introduce, this is obviously from the Connecticut Newborn Diagnosis and Treatment Network, Debbie Ellis, who is the program coordinator for the Connecticut Newborn Diagnosis and Treatment Network. As a RN and educator with over 20 years of experience in a clinical setting, Debbie has focused on her clinical experience in the area of neonatal nursing, as well as improving the family experience, and was actually the recipient of the 2018 Nightingale Award for Excellence in Nursing. As part of this team, we also have Ginger Nichols, who is a genetic counselor with over 20 years of genetic counseling experience in clinical research and in academia. Ginger has also worked for over 15 years writing patient and healthcare provider health literature, and has been involved in running support groups and played a fundamental role in the creation of the Newborn Screening Family Advisory Group, which you will all hear about. I think it's great to see all of these different experiences coming together to make this program possible. Next slide. Then we have our ScreenPlus team, which is a large consented multi-disorder identified prospective newborn screening pilot program in the US, and it is offering infants born at 8 hospitals in New York the opportunity to screen for 14 complex and rare disorders, in addition to the standard 50 conditions that are currently part of the New York panel. And we have today presenting for that program Natalie Boychuk, who is the assistant project manager for ScreenPlus and coordinates the Ellis study. Natalie holds a Master's of Public Health from Columbia and specializes in quantitative research methods. Next slide, please. So during registration, we asked, what does it mean to engage families or communities in the newborn screening system? If you've participated in our webinars before, we like to ask a lot of pre-questions so that we get a sense of where everyone is coming from. And so while we get a sense of who's here today, we wanted to share a few of the responses to really ground us in what engagement means to all of us. It's one of those words that's used all the time, and it's great to get a sense of what people are thinking and how they tend to use it. And so some of the feedback that we got was, more engagement means that more babies can be saved. Families know their children best and should always be engaged in every step of the way. To actively look for ways to engage families and meet them where they are. I love that, especially that actively. It takes a lot of effort. We need to hear from families on the best ways to meet their needs. Education and promoting advocacy is what it means to engage families and communities. And then also families become better educated about the newborn screening system and the newborn screening screening system delivers what's most important to families. So as you can see, a lot of families, a lot of orienting around that, and a lot of education. Next slide. Great. So with that, we will have the team from Connecticut give us a little bit of a presentation on the work that they've been doing.
Thank you, Natasha. On behalf of our entire network team and the families that work with us, we are genuinely excited. Thank you so much for this award. We hope that being recognized as a recipient of the GRACE Award helps to highlight the need for newborn screening family advisory groups on a statewide and a national level. You can go to the next slide. So I wanted to just give you a little bit of background of newborn screening in Connecticut. The Connecticut Newborn Screening Program at the Department of Public Health State Lab has historically been the hub for all things newborn screening related. However, in recent years, with the newborn screening field evolving quickly, they had identified a need to expand. They had been reporting to 8 different specialty care teams at multiple locations. They wanted a centralized reporting center with consistent workflows across the state. There were increasing needs for education and genetic counseling, and there was a limited ability to report on long-term outcomes, which we all know is up in the new thing in newborn screening. We need to track long-term outcomes. In 2018, the Connecticut Department of Public Health created the Connecticut Newborn Diagnosis and Treatment Network, which we refer to as the network, to address these needs. The Connecticut Newborn Screening Program at the State Lab and the Connecticut Newborn Diagnosis and Treatment Network combine and work together to form the Connecticut Newborn Screening System. In coordination with the infant's primary care provider, the network begins the diagnostic workup and provides support to both the healthcare team and the family. We staff a newborn screening info line for parents and providers. We provide educational materials, again, for parents and providers. We provide access to genetic counseling. We track long-term health and developmental outcomes, and we're able to do all of this electronically. After the network's launch, we learned quickly that there was a disconnect in the newborn screening system. Families were not being provided with sufficient information, and there was a lack of consistency between the providers. Families were often confused and blindsided when they were notified of an out-of-range screen. We've heard many, many stories. These are just a couple of examples. My baby's doctor said that he failed the PKU test. I spent weeks researching and learning everything about PKU while I waited for the test results. When we finally met with the geneticist and learned the name of the condition, I was so upset that I had wasted all that time learning about PKU when that wasn't even the condition. Another one talked about a nurse from the pediatrician's office called and said she had to go immediately to the emergency room. Once she got there, the baby was poked again and again to get multiple lab draws. Nobody could explain to her why the baby was there. He was admitted to the hospital, and it was 5 days before anyone ever told her the name of the condition that her baby had flagged out of range for. We'd also heard a couple stories in Connecticut of providers who told the parents that their prognosis was very poor and they should go home and spend quality time with their baby because they didn't have long. All of this is very traumatic for the parents, and we wanted a way to help to improve this experience. The network was in a unique position of being a new facet of the Connecticut newborn screening system. We were still in the early stages of creating workflows, so it was really an ideal time to solicit feedback from families so that we could design our workflows with their suggestions in mind. Ginger and I talked, we knew what we wanted to do, but we had no experience running a parent support group. We knew that we needed clear goals, and we needed a little bit of education ourselves about how to keep families on task. We didn't want it to be just complaining, we wanted it to be constructive. So we had to reach out to get some help. Next slide.
So to help us with our goal of creating a family advisory group, we sought the expertise of PATH Connecticut, which stands for Parents Available to Help Incorporated. So PATH CT is Connecticut's hub for several well-known organizations such as Family Voices, Family to Family Health Information Center, Parent to Parent USA, and Youth and Sibling Leadership Networks. PATH Connecticut provides training, resources, supports, and services that help families to navigate healthcare and to make informed choices that foster family professional partnerships. So perfect match for this, right? We met with PATH several times to discuss what we wanted to get out of a family advisory group and discussed areas where we wanted feedback. We created a goal, which is to create an environment where families and clinicians work together as partners to improve the newborn screening experience. Because patients and families have different abilities to engage, PATH offered training sessions to all members prior to the first meeting to go over expectations of this commitment and to give them the confidence to be active participants. We also offered all families the parent-to-parent support training. And we decided that we would meet with a family advisory group every other month for 1 hour with an initial focus on getting feedback on how to improve our workflows and communication results during the pre-diagnosis phase. Next slide, please. Hearing the family voices, Debbie said, was a goal that the network had from the very beginning. However, when we thought about logistical barriers, such as what would be a central location to meet, how far is too far to expect families to travel, should we offer or provide childcare? One silver lining to COVID was that everyone was going virtual. This made it easy to envision a Zoom type of meeting for our family advisory group. In addition, we were a grantee of the CARES Act, Maternal and Child Health, Telehealth Capacity and Public Health Systems Direct Awards. And the network used some of that funding to establish our partnership with PATH Connecticut that helped recruit, train, and run the family advisory group. Next slide, please. Our biggest challenge was recruiting parents. We started by first reaching out to families who had already shared some feedback with us. We then emailed families we had been in contact with over the previous 6 months. Most parents I reached out to by email did not respond. So this was another area that PATH Connecticut helped us to problem solve. PATH aided in finding some families from their parent-to-parent support trainings, and they helped us to create a culturally diverse group. We did offer families a $25 gift card incentive for each meeting and training that they attended. And we recruited 6 families. We held an introductory virtual meet and greet prior to officially starting so that we could get to know each other and discuss goals and expectations of the group. And we found the best time that would work for everyone to meet. We emphasized that we'd be looking to them as valuable partners in efforts to improve the experience and overall quality of care for families who receive a newborn screen that was out of range. Next slide, please. The initial focus was to improve workflows and communication results to improve the family experience during the pre-diagnosis phase. We went into each meeting with a loose agenda, which would be emailed to parents ahead of time so they could think about the topics. Our meetings were lively and the parents were eager to share their experiences. We kept families engaged by involving them in every step of the process. As we identified a need, we would brainstorm a solution together. If there was a need for educational materials, we would bring drafts of those materials to the meetings to review. If there was a need for a change in the workflow, we would keep them up to date. And if that new workflow was implemented and how it was going. And at the end of each meeting, we recapped and got topics for future meetings. The team was excited to see the educational materials that were produced, and it actually, they voiced a sense of accomplishment in having a hand in helping to create some of these educational materials. Next slide, please.
So this is a recap of some of the common themes that were identified through our meetings and how we chose to address it. We shared this chart with families at our last meeting of the year so that they could see the results of their feedback taking action. There is a desire for the first contact about an out-of-range result to be from the primary care provider, not a nurse, not the receptionist, not a MA. Families appreciate their pediatrician or APRN calling them to notify them of the results. This is something that we're emphasizing in all of our education to pediatric offices. We don't expect every PCP to know the ins and outs of every condition on the newborn screening panel, so we are encouraging them to provide them with the network info line number so that if parents have additional questions or concerns, they can reach out to us directly. This is something we're really trying to stay true to. We have some workflow changes right now where we think it might work best if we contacted the family directly, but parents really want that first contact to be from their pediatrician, so we're trying very hard to stay true to that. Families who had an ER or hospital stay really felt uninformed and overwhelmed. We learned that while maternity and NICU nurses may receive some little bit of education regarding newborn screening, nurses on the ER and med-surg floors really don't receive any newborn screening education. So we have disseminated newborn screening materials and offered educational sessions to the pediatric ERs and floors in Connecticut. This should provide some resources and improve the experience for dozens of families a year who require hospitalization. Families recounted numerous stories of frustrating lab experiences. On a day-to-day basis, this is probably the source of most frustration in the network. Outpatient labs are not great with the pediatric population. They are often not staffed with pediatric phlebotomists. The children's hospitals in Connecticut are great, but many families don't want to travel over an hour to get there or park in a parking garage and go into the city, which I can understand. You have a baby that's a week old and that is a hardship. They often don't have the proper tubes, the right supplies, the right size needles, and they're definitely not educated about newborn screening. Some families have suffered multiple unsuccessful blood draws. Several families were given incorrect information by phlebotomists who had no newborn screening training. So we worked with Connecticut's largest outpatient lab, Quest, to identify locations for additional pediatric training. And they identified, I think, 8 locations in Connecticut that received additional training about drawing blood on the pediatric population, and they were given additional supplies so that they would be able and prepared to draw blood on newborns. This will help to streamline and improve the lab experience for hundreds of families a year. We also created a newborn screening brochure with feedback from our family advisory group that was disseminated to all of the outpatient labs in Connecticut, and that was Quest, as well as the labs at the major hospitals. And the purpose of this was twofold. We think that expecting moms sit in the lab when they're having their glucose tolerance test and maybe looking for something to read. So there's a little nudge for prenatal education there, as the rack card will be easily available to them. But also when families present at the lab and they ask the phlebotomist, why do I need blood drawn? When will the results be ready? What is this condition? The lab can reference the rack card and say, here's some information. This should answer your basic questions. If you have additional questions, you can contact the network, and it has our email and phone number on there. Next slide, please. So most of the families, I think all of the families in our family advisory group had not received any prenatal education regarding newborn screening and felt overwhelmed and shocked when they received the results. So the network spearheaded an initiative to begin prenatal newborn screening education in Connecticut. We drafted a letter with the help of the Department of Public Health. We created a brochure with the help of our family advisory group, and we disseminated these to every OBGYN office in Connecticut. We also designed and purchased newborn screening Band-Aids that look like this for every newborn in the state. We're hoping that this Band-Aid will provide a visual cue to spur a discussion between the provider and the family at the time of the screen. We were hearing that many parents in the maternity ward were told that the baby needed blood work, and the screen might be done in front of them, or the baby might be taken to the nursery. And then the baby was brought back and said, all set, the baby weighs 7 pounds, passed the hearing test. And there was never really a true conversation about newborn screening and what that meant happening. So we're hoping that this Band-Aid reminds the nurse that she should be having that conversation with the family, or it might cue the family to say, what is that Band-Aid about? And they'll have a little talk about it. We've also developed a video, before this family advisory group, for the staff on the maternity wards about how to talk to families about newborn screening. So we're hoping that the combination of these initiatives will help to increase overall awareness of newborn screening in Connecticut. Next slide, please. Many of our families felt that the language was confusing. In Connecticut, we screen for almost 70 conditions. Yet we still hear many providers refer to the newborn screening blood spot card as the PKU test. This is outdated and confusing for parents. So this is a poster that we created for pediatricians' offices, birth hospitals, and NICUs, stressing the importance of using proper terminology. It lists the name of every condition that Connecticut screens for, and then at the bottom it says, in Connecticut, the Department of Public Health screens babies for over 60 conditions. Using the term PKU can be confusing and misleading. Please help us change the dialogue by using the term newborn screen or newborn screening blood spot test. Together, we can help save lives. Next slide.
As a result of the family advisory group, the network modified workflows and added educational initiatives, just like Debbie kind of stepped through. We hope that these changes will increase overall awareness of newborn screening in Connecticut, as well as improve the lab and hospital experiences for hundreds of families each year. We formulate, back to our family advisory group, we set up kind of a formal evaluation process, and we're using the tool that was created by Family Voices. It's called Family Engagement and Systems Assessment Tool. So we call it FESAT for short. We emailed the questions to the members in advance, then met as a group to discuss each question, and there's a ranking system involved in it, but it helps us to see areas we might need to work on or what's working and what's not. The families did have the option of sharing their feedback by email. They didn't feel comfortable sharing in a group, but they were, by this time in the group, everyone was comfortable giving some honest feedback. Next slide, please. We highly recommend that all healthcare teams consider ways to empower the family voice. And for those who want to create a family advisory group, we suggest partnering with a group like PATH or Family Voices. We also think it's important to have dedicated, consistent staff that attends all the sessions. And it's important to include compensation for families into your budget and to have regular check-in evaluations. Next slide, please. As you can see, this has been a very valuable experience for us. We plan to continue the family advisory group, and all current members of the group are committed to continuing, and we have plans to recruit more families to incorporate a more diverse range of diagnoses. We are switching to quarterly meetings. Every other month was getting a little too much, but we've also heard that going less often than quarterly, you can lose engagement. Overall, when providers partner with their patients and families, opportunities arise for improvements in patient safety and healthcare quality, better patient-family experiences, and increased provider job satisfaction. Family advisory groups provide a way to connect with families and turn the volume up on their voice. They offer a mechanism to move towards a culture of family-centered care. Families have valuable feedback to share, and their experiences are crucial to improve the newborn screening experience. We are very grateful for this opportunity to learn from one another and to highlight the Family Advisory Group. Thank you for your time.
Thank you so much for that presentation. For everyone, if you have any questions, please put them in the chat. We will hold them till the end. I know I have a couple that I want to ask, but we'll wait until we hear about the great work that ScreenPlus is doing. Natalie, take it away.
Thank you so much, Natasha. And on behalf of the whole ScreenPlus team, I really want to extend a thank you to Baby's First Test for this amazing award. It's such an honor to be able to speak with everyone today about our experiences engaging families and learn from others as well. So if we can go to the next slide. So before I dive into ScreenPlus a little bit, I wanted to speak a little bit about why we as a newborn screening pilot program care about engaging parents in newborn screening decision-making. So we all know that newborn screening technology has advanced substantially since Dr. Robert Guthrie developed the test for PKU in 1962. We can now screen for many more conditions, as Deborah highlighted, some of which have later onset or are untreatable. This has prompted quite a bit of debate in the bioethics community. Some critics claim that newborn screening can lead to some harmful consequences, while others emphasize the fact that newborn screening removes the diagnostic odyssey characteristic of most rare disease journeys, and potentially enables families to make decisions about family planning. Despite this really lively discussion, there's little empirical data on what parents want and the impact of a rare disease diagnosis through newborn screening on a family. So if we'd like to ethically and appropriately advance newborn screening, understanding parent perspectives is crucial. So can we go to the next slide, please? So that's really where ScreenPlus comes in. ScreenPlus is a new model for pilot newborn screening. We began screening on May 10th of this year. And we're the largest multi-disorder consented identified prospective newborn screening pilot program in the United States. We're comprehensive, meaning that not only are we conducting the pilot newborn screening and developing screening assays, we're also following up with infants who receive positive or uncertain results long-term, following up with treatment, and conducting a study of the ethical, legal, and social implications of screening, which I'll elaborate on shortly. We're currently testing a fluid panel of 14 rare complex disorders, and we engage parents throughout the process, beginning with informed consent right around the time of birth. So if we go to the next slide, I will let you know a little bit more about what that informed consent looks like. We've employed research coordinators in each of our 8 pilot hospitals who will speak directly with every parent who gives birth about newborn screening. On average, we have a consent rate of about 64% from the period of May to July of this year. As you can see on the right, the blue line represents the consent rate and our green line represents the declining rate. We're really excited about this because it's actually quite an improvement compared to how we were performing at the launch of our previous pilot. This being said, we're continuing to take in data and tips from our coordinators who are out on the floor to refine our processes based on what parents want to make decisions about this pilot newborn screening. And we're also developing a passive strategy to sort of cope with potential challenges from COVID-19. So this would allow parents to get the same information without having to have an in-person conversation necessarily, although in-person engagement is still a #1 priority for us. So if we can go to the next slide. So as I mentioned earlier, one major component of ScreenPlus is a study of the ethical, legal, and social implications of newborn screening. So at the time of this informed consent, we ask all parents if they're interested in participating in surveys. We expect to have screened about 175,000 newborns by the end of 5 years. So even if only some subset of parents are interested in participating in this work, we'll still have thousands of parents willing to give their opinions about newborn screening. We'll also be conducting qualitative interviews with parents of infants who receive positive or uncertain results to get some more nuanced information about what that experience looks like. And I'll be elaborating on that shortly. Can you go to the next slide, please? Thank you. So big picture, why are we surveying parents? We would really like to get some crucial information on one, why parents are interested or why they're hesitant in participating in ScreenPlus and screening for other conditions that may join the RUSP soon. We're also interested in learning more about how newborn screening can be delivered better and what materials parents need the most to make decisions. How can parents best be supported to understand the results that they're given? And third, we would really like to understand what it means to receive a positive or uncertain result as a parent. How does it change your diagnostic journey and your diagnostic story? So next slide. Next slide, please. Thank you. So here you can see how we're sort of engaging parents in this LC timeline, in this LC study sort of across a period of time. So immediately after birth, all parents, regardless of whether they choose to participate or not, will be offered the opportunity to complete a survey. This survey will ask them a little bit about how the consent process was for them, how well they understood information about our study, why they might have wanted to participate or why they were hesitant, and some socio-demographic factors as well. For those parents who receive a negative result, about 1 month after their pediatrician receives results, we'll be sending out a series of surveys asking about opinions about newborn screening for late onset untreatable disorders, whether parents would like to have information to help them make reproductive choices, and broader questions about whole genome sequencing and other topics related to the ethics of newborn screening. For parents who unfortunately receive positive or uncertain results, we'll be waiting about 6 months and then starting qualitative in-depth interviews. This will give parents the opportunity to speak with one of our researchers directly and give a more full picture of what newborn screening meant to them, what the impact was on their mental health, their finances, their relationship with their partner and their other children, how it affected the way that they parent, and the supports and resources that were needed. We'll also be diving a little bit into how exactly their results were communicated and how providers could have been better and what was done well and what wasn't in terms of how newborn screening results were communicated. So next slide, please. And so taken together, we really hope that all of these study tools kind of come together to give us a better idea of what parents want from newborn screening and genetic information more broadly, the benefits and impacts of newborn screening for parents, and how we can improve newborn screening implementation to better meet parent needs. Next slide. And we see some real practical outputs and impacts of this study. Ideally, we'd like to share this information to benefit RUSP applications and advocacy efforts and show that there potentially is a benefit to newborn screening for families. We would like to provide recommendations to public health labs and providers on resources and strategies to improve newborn screening implementation. Particularly as it pertains to communication and education. And third, we're already taking in data every week and improving the way that we do what we do, but we'd like to develop a model and a framework for other newborn screening pilot programs to show that not only is engaging families necessary, but it's also doable for newborn screening pilots like ours. Next slide, please. So we've been working quite hard as a team to develop these study instruments, and I wanted to go into a little bit what that process has looked like. So our ScreenPlus Coordinating Center is based here at the Children's Hospital at Montefiore, and we work with Dr. Erin Goldenberg, who's a bioethicist at Case Western Reserve, and Dr. Maria Kafalis, who is a sociologist at St. Joseph's University and a patient advocate with Cure MLD. Together as a core group working on this in-depth interview guide, we come together with both, technical survey and interview guide development experience, and also lived experience and knowledge of what is appropriate and what the right questions to ask are. So we're really trying to strike a balance between, rigorous scientific data that is appropriate for families. We'll also be piloting our in-depth interview guide with our community advisory board, who I'll elaborate on a little bit shortly. Our community advisory board are leaders of patient advocacy organizations, and many are parents of children with rare diseases. Next slide, please. So as I mentioned, our community advisory board, we have 12 members across 11 patient advocacy groups. The majority of our members have a child with a rare disease and have that lived experience. We meet annually with our community advisory board and provide study updates, and they review our study materials, ensure they're appropriate for parents. And importantly, our community advisory board also provides support to families. We have an excellent repository we're beginning to build for those families who do receive positive or uncertain results, to get them connected to support resources right away. Next slide. So you might be wondering sort of how this recruitment is going to work. So there's the obvious sort of channel in that parents whose children have taken part in ScreenPlus, who were engaged at birth, consented to have their newborn screened for these disorders, received a positive uncertain result, and got connected to care. They will then be approached and be given the opportunity to participate. However, we know that with rare diseases, we may actually not get enough positive cases, even over a 5-year period, to get a real range of parent experiences. So we've started to think about how we can expand those recruitment channels. So we will be establishing some connections with providers at pilot hospitals who are already treating babies with RUSP conditions, and parents of children with those conditions will be given the opportunity to participate. And we're also engaging the broader newborn screening community. So those who may not be in our pilot hospitals, but are engaged with a patient advocacy group will receive some information about our study and be given the opportunity to complete a short survey to see if they're eligible. We'll also be reaching out to Facebook support groups and doing a really exciting method called snowball sampling, where every interview that we conduct, we will ask parents to identify another person that they know who might be eligible and might be willing to participate, so that we sort of get deeper and deeper into these parent networks. Next slide, please. And so far we've taken away a couple of key lessons. First and foremost, it really does take a village to make such a comprehensive project like this happen. We're funded by the NIH as well as industry and advocacy partners. And we received some advice both from our community advisory board and also technical advice from our scientific advisory board. And so for state programs looking to expand this kind of project, we're hoping to have sort of a framework of how this collaboration works. Our second lesson and our takeaway is that transparency is key for genuine engagement. We spend a long time as a team talking about how to communicate with parents and how to give them information about exactly why we're conducting this pilot study and why it might be beneficial for their family. Many parents are, rightfully so, hesitant about participating in research. And so really being transparent and open from the beginning is really important to build that trust. And sort of building into that, in-person engagement has been such a worthwhile investment for us. We've heard anecdotes already of the benefit of having a research coordinator who can go in and speak with a parent and answer their questions, and even just let them know that they're listening and that their concerns are valid. We truly believe that having a research coordinator there at every hospital every day to speak with parents is really a key part of how we engage parents. And next slide, please. So I'd just like to take a moment to acknowledge the village that makes all of this happen. We have a wonderful community advisory board and scientific advisory board, as I mentioned, and a wonderful set of principal investigators at our pilot sites, as well as our collaborators at the New York State Department of Health and all of our sponsors. So it really, really is a team effort to make ScreenPlus happen. Thank you very much, and happy to answer any questions.
Great, thank you so much. And yes, now it's time for us to discuss. If there are any questions, please send them in. You will also see a poll pop up just so that we can get a better sense of who is on the line. So if you wouldn't mind to fill that out, we greatly appreciate that. I believe there are 3 questions on there, so just scroll down. This really does help us in our building out what we present back to this community. So my first question is really for the Connecticut team. And, I thought it was so interesting and important that you really set those goals for everyone. Sometimes when people kind of consult with Baby's First Test asking what they should do and how they should approach it, there's a real focus on families, which is great. But oftentimes we say, well, whoever's involved in the collaboration needs to commit to the same set of goals, rules, depending on how it's structured. Can you talk a little bit about kind of how you decided to really, and I want to make sure I'm capturing this correctly, that, when you were setting the goal of creating an environment that was, accessible and comfortable for all, and some of the training that you did, it sounded like some of the non-parents, non-family representatives also took part in the training. Is that correct?
That is correct. So like I kind of touched on a little bit, Ginger and I and the whole network, we knew that this was something we needed to do, but we didn't really know how to go about doing it. And we didn't just want to invite a bunch of parents and get together and have it break down or get out of control and us not be able to handle it. So that was kind of why we reached out to Path CT, our family advisory group. And they were very clear about when we're getting parents together, you need to tell them upfront from the very beginning what is expected of them. How often are you going to be meeting? How long are the meetings for? What exactly is the reimbursement going to be? What topics will we be discussing? At the end of that period, you will have an option to leave or to sign on again for another period if we continue to do so. And these are some sample topics to discuss. And I think that they had also suggested that we use the FESAT tool for family engagement. And something that the FESAT tool recommended was when you read through it, it says, are goals and questions clearly defined for families? So we knew right from the beginning, from previewing that tool, that was something that we would be evaluating at the end, and we wanted to be sure that we were touching on that. So we tried to really help parents to know what the goals were ahead of time and then to address them. We didn't want them to think that we were just taking what they were saying. We wanted them to know that we were acting on it. And I think that it was really well received when they saw that they provided feedback, and we then went and made materials with that feedback. And we brought the materials back to them and said, what do you think? Is this what you had in mind? Is there anything you would do to change this? And they did have suggestions about the wording. Sometimes they said, this is too wordy, I just want bullet points. We don't need to get into all these details. And other times they said, there's not enough information here. It doesn't seem friendly enough. We need to soften it up a little bit. Or they would say that they would prefer just a single rack card as opposed to a trifold brochure. Very simple things, but it was nice to get the parent input on that as opposed to us just saying what we assumed would be best.
Great. And I think that one point that you're also making is that you took feedback not just on content, not just on the what, but the how. The example of instead of the trifold having just the rack card. That's something that we've been thinking a lot about in terms of it's not just the content, there's so much great content out there, and sometimes it doesn't really get to families because of just how it's presented. And even something as little, or that may seem as little as, well, it's both paper and you can pick both of them up, but, to be able to get that type of feedback from families and then to act upon it, I think really shows just that great relationship building that you're doing with that.
And I think that extends even into the dissemination of information, because we created some great materials, and there's wonderful materials out there. There's a plethora of materials on the Baby's First Test website from other newborn screening programs. But if it's not in the right place at the right time, it's not having the proper impact. So I think just by disseminating it to the labs and the ERs, that hopefully it will be available when families need it.
Yeah, absolutely. And the need to be in multiple places, because you never quite know which place is going to be the one that hits. As I hope some of you can see, Brianne posted a question that we have to all of our participants today, and everyone who is in the audience, about what barriers do you face when you're engaging families in the newborn screening system. And so feel free to add your perspectives on that question in the chat. My next question is for Natalie, and you spoke about the community advisory board and the different representatives from different patient advocacy groups who are on there, as well as really multi stakeholder collaboration that is ScreenPlus. Can you speak to, I feel like this is maybe a two-part question, when you bring lots of people together with lots of experiences, sometimes you get disagreements, or I wouldn't even say disagreements, but a variation in perspectives, right? Different people sometimes, when you get to the nitty gritty, have slightly different priorities or different perspectives. And sometimes that's what you want. You want to see what's out there. Could you speak to anything related to that, either with that larger multi-stakeholder collaboration, but also in particular, I think it's great that you have so many different patient perspectives, because there isn't just one patient perspective, the same way there isn't just one parent perspective, and just kind of how do you navigate that if there's ever been anything that's come up that, again, not necessarily disagreement, but just like, oh wow, people are looking at this with slightly different perspectives, and you as the research team need to think of how to harmonize that.
Of course, thank you. And I'd also like to invite my team members as well, Dr. Wazerstein, who's our principal investigator, and Nicole Kelly, in case if they have anything to add as well. But it's a great question, and I think it's something that is challenging and exciting about working with such a diverse group of people. I think one of the things that we're really lucky about is the fact that we have, even though we have people coming from different viewpoints, we all have a common goal. And I think constant reminders about the common vision about newborn screening, even if we're sort of coming at it from different places, is really, really important. I also think that there's something built into our structure in that our core coordinating team here at the Montefiore Children's Hospital kind of takes in all of these different perspectives. And so we sort of have this harmonizing force in the center of our structure that I think makes a real difference and can kind of help keep things, keep different perspectives getting integrated without, compromising how effective and efficient we can be in terms of decision making.
Great. One question that we have coming in from the audience is back to you, Natalie, is, really thinking about the ethical aspects that you are looking at, and just a question around, is the Secretary's Advisory Committee for Heritable Disorders in Newborns and Children involved in any way, either in terms of suggesting issues that they may like to understand better or anything else?
I think, certainly there's definitely inspiration coming from there. Dr. Erin Goldenberg, being an expert in bioethics, really does contribute that lens of things for us in terms of that expertise of what RUSP panels tend to look for. So it's sort of an indirect mechanism, but the inspiration is certainly there.
Great, thank you. A question I have to all of our presenters is, if there was one thing, and I know it's not just one thing, but I will still ask the question, if there's one or two things that you think really made your engagement efforts successful, and I would say made and is making, because the work that you're doing is still continuing, what would that be?
I would say our partnership with PATH in Connecticut helped with the Family Advisory Group is the one thing that really made it successful.
I would say our involvement of parents right from the beginning, as we develop these survey tools, have really been critical for us, and the in-person engagement that I previously mentioned has been really critical for that trust building.
One thing, a theme that I think came up quite a bit in both of your presentations were the opportunities for in-person or face-to-face contact. So even if it's through Zoom, really person-to-person meeting and discussing. And I think of that even in terms of the work that, Connecticut, that you're doing with the stickers. That is a touch point for every single baby. And I just wonder if you can speak to that in terms of how important that is. Obviously, people like to think of awareness campaigns that are broad and kind of may blanket everyone, but a lot of the work that both presentations touched on were really the more individual, or how are we reaching each family, or how are we having these connections with each person who's going to be a participant. And just wanted to kind of get your sense of that as a strategy and kind of why that's important in both of your programs.
It continues to be very surprising to me how every baby receives newborn screening, and yet nobody knows what it is. Even healthcare providers can't speak very well about it. And I find that very frustrating. Especially in prenatal and the newborn period, there's so much education out there. And I feel like parents are hungry for information at that period of time. And yet we kind of skip over the newborn screening information the same way that you skip over the chapter about C-sections, because you don't think it applies to you until it does apply to you. And I like the idea that we're touching each baby in Connecticut with this. And it provides an opportunity. If you haven't been taught yet, we can teach you about it right now. And it is a time that is a blur, and a lot of parents don't know what's happening in those first 24 or 36 hours after birth, but that Band-Aid stays on for a few more days. So it gives them multiple times to notice it, to think about it, to ask a question. We have had really good feedback from hospitals who've asked for more. So we've ordered another year supply of them so we could reach babies for another year. And the pediatrician's offices as well, when they do the repeat newborn screenings at the office, have really enjoyed them and have asked for more as well.
I completely agree with Deborah. In-person engagement has been a really, really important piece for us as well. I think so often strategies look at, getting everyone at the lowest possible cost. But I think if you think about the fact that every newborn deserves to have this information, each individual parent that you reach becomes equally valuable. And so we really take the time to make sure, and we've heard some really wonderful stories just about, parents who are really worried, like, I don't want my baby to be a lab rat. And our research coordinator has been there to say, I hear you and I'm listening to your concerns, and here's actually what's going to happen in the process, and here's what you can expect. And we've actually had really wonderful stories of people who were really hesitant and worried come around and say, actually, this really is a great thing that my baby is being offered for free that I have access to. And so to us, every single additional parent who agrees to participate is an important contribution to our study. So it kind of goes down to our philosophy.
Great. I love that in terms of, every baby deserves to get this information. And so how do we put an investment into that? And I think it's very true. Sometimes we think, a parent who may be asking certain questions that may seem naive or what have you. A parent that's asking questions is a parent that's engaged, and that is our 100% our goal. And I say our as a collective newborn screening community, and to be able to meet that engagement with validation and information is key. So that is really great. I really appreciate both of those perspectives on that question. Another question that we have is, from all the lessons learned that you've had, and you're presenting from two kind of different perspectives. One is more on the research side of things, and the other is more like embedded in the public health program. What can programs or other partners who are thinking, wow, this is great, and I don't even know how I would start with this? From a research perspective, well, not just research perspective, every perspective, budgets are tight, time is tight, and we know that people tend not to do things not because they don't want to, especially in this community, but sometimes you just have to have a starting off point. What would be your suggestions or strategies that, again, either a program or a research group or, anyone who's looking to engage families in the newborn screening system, what are some of those first steps you could suggest for them to start with?
I think from our perspective, it's really been, making those partnerships with others. And so especially, research capacity, I know that so many public health programs are at capacity with all of the amazing work that they're already doing. And so forming those partnerships with academic institutions, with others who can sort of spearhead these other components, that's really been something that we've taken from this. And so, beginning those conversations, I think would be a first step.
I think I have a couple of first steps. One would be if you want a family advisory group, to just kind of think of families that you've spoken to recently, or as you're moving ahead, think of families that you think have all families have something valuable to share, but some families are more willing to bring their story to the table and make suggestions than others. So if you encounter a family that you think is a little more outspoken or might like to be involved in something like that, is more highly engaged, I would just keep a list somewhere of families that you may want to reach out to include them. And you can start small. Our first year, we only had 6 families. We're hoping to increase that. And we got an abundance of information from just those 6 families. It doesn't have to be big. And I think that partnering with a family organization such as PATH was really valuable. And it's valuable whether or not you want to form a family advisory group to meet certain goals, just to have them as a resource for developing other materials that we're currently working on, questionnaires, and to be able to refer families to, I think is really valuable. And I'll also say that, there's money involved in doing all of this, and money is tight. We wouldn't have been able to do it without the AMCHIP grant. So we're always on the lookout for ways to fund initiatives like this. We have lots of grand ideas. We just need the time and the money to make it happen.
Thank you so much for that. And our last question before our time is up, before I get to that, for all of our participants who are on the line, we have a link in the chat that has a link to just 7 questions in a Google form. Again, this really helps us plan our future programming that we're able to provide, as well as just get feedback on how we are doing. So please fill that out if you can. And now to the last question we have for today. As what methods are in place to share and establish, to share these established strategies widely across the country? As I said at the beginning, one of the reasons why we wanted to do the Grace Awards was to be able to highlight this work. We're fortunate enough to be able to hear about it here and there, but really wanted to elevate the great work that sometimes doesn't get as much attention. And so, this is one way of doing that. But just wanted to hear from you if there are other ways that you are thinking of sharing the strategies that you've come across, or if not that, then are there ideas that you have for how it would be great to be able to share this type of work that you're doing?
Sure, I can start. I think, one idea, one thing we talk about a lot as, a research program is that some of the channels that are traditionally used in academia don't make it to patient advocates and to parents and the people that we want to get this information. And so one of the other, fantastic benefits of our community advisory board is we have a community of people who are extremely connected to all of the people that we would like this information getting to. And so sort of using those channels that we're establishing to share information, and also developing out our social media quite a bit has been helpful so far, and hopefully will continue doing so, so that not only scientists but also folks who can really take this forward practically can get access to some of our learnings.
I think having webinars such as this is a great first step to spreading what we're doing and to learning from about what other people are doing. I think it would also be great to have some type of mechanism, an informal mechanism, to learn about what other newborn screening programs are doing. I know that there are listservs out there that are sometimes a little bit clunky and formal, and there's a couple Google groups that my password never seems to work for, and I always have difficulty accessing. But it would be great if there was just something as simple as, I don't know, maybe a Facebook group or something online, a chat room on a Expecting Health website, where we could ask questions and say, we want to provide something about the first contact. Who can share information about what they're doing in terms of the first contact? Or do you have condition-specific information sheets about hemoglobinopathies? And you can put that question out to everyone in newborn screening. So if another state has something on that, you can get information from them instead of trying to start from the very beginning.
Great, very good suggestions, and definitely something that we can definitely look into to see how we can be supportive in that way. We are 1 minute over, but thank you so much to our panelists and to our participants online. This was great. And I know that there are a number of people who said, oh, I can't wait to reach out. So that is great to be able to have those connections. Please don't miss the last webinar that is in our 2021 Newborn Screening Series as part of our Newborn Screening Awareness Month series. That will be happening on Wednesday, September 29th from 12 to 1 Eastern Standard Time, where we will be focusing on raising awareness for newborn screening, of course, and really looking at from the family perspective. Experiences in newborn screening and how some families have navigated the world of newborn screening post a diagnosis. Thank you again to our presenters, and I hope you all have a great, great, great afternoon.